Imagine a world where medication only attacks the disease, leaving healthy cells untouched. Sounds like science fiction, right? Well, targeted drug delivery is making that a reality, revolutionizing how we treat illnesses like cancer and autoimmune diseases. Today, we're diving into the fascinating world of targeted drug delivery, what it is, how it works, and why it's such a game changer. We'll explore the core concepts, the ingenious methods scientists are using, and the incredible potential this technology holds for the future of medicine. The traditional approach to drug delivery is like carpet bombing. The medication spreads throughout the body, affecting both healthy and diseased cells. Targeted drug delivery, however, is more like a precision strike. It involves attaching drugs to specialized carriers, often nanoparticles, that are designed to recognize and bind to specific markers on diseased cells. Think of it like a guided missile. The carrier finds its target, releases the drug, and minimizes damage to surrounding tissues. For example, antibodies can be attached to nanoparticles to target cancer cells expressing specific proteins. So, how do these carriers actually find their targets? There are several clever strategies. Some utilize the body's natural pathways, exploiting the fact that diseased cells often have leaky blood vessels. Others rely on external triggers like light or magnetic fields to activate the drug release only at the desired location. Researchers are even developing smart nanoparticles that respond to changes in the tumor microenvironment, like pH or enzyme levels, to release their payload precisely when and where it's needed. Did you know that some targeted drug delivery systems are inspired by viruses? Scientists are repurposing viral shells, called capsids, to safely deliver therapeutic payloads. These capsids are incredibly efficient at entering cells, and researchers are engineering them to target specific diseases. Furthermore, the field is rapidly expanding, with researchers exploring everything from liposomes to polymers to deliver drugs with unprecedented accuracy. To recap, targeted drug delivery represents a paradigm shift in medicine, moving away from broad-spectrum treatments towards precision therapies. By delivering drugs directly to diseased cells, we can improve treatment efficacy, reduce side effects, and ultimately, improve patient outcomes. If you found this video informative, give it a thumbs up and let us know what other science topics you'd like us to explore in the comments below. Don't forget to subscribe for more exciting science explanations.